So diabetic retinopathy, I have the discussion with pretty much all of my patients with diabetes because most of them don't always know why they're coming to see me. They don't always know what it is that I'm doing. They know that yeah, I've got diabetes, it can affect my eyes. And it's true, it can affect your eyes. But I like to have this discussion with patients because I like to allow them to understand their diabetes because at the end of the day, when we're looking inside of someone's eyes and trying to assess for diabetic retinopathy, we're not just doing it for someone's eyes. We're getting a good window into overall cardiovascular health.
Mm.
And what I mean by that, if someone has diabetes, then their ability to regulate the level of sugar inside of their blood is not as well controlled as it ideally should be. And so what happens is that our body either cannot produce insulin or it does produce insulin that the body doesn't respond to that well. And insulin is really important at taking that sugar out of the blood and storing it. And so if our body can't do that, whether because it doesn't produce insulin or it doesn't respond to the insulin, those blood sugar levels will rise. And then or the other way to think of it is they don't decrease at a rate that is healthy. And so when we have a sugary meal, those blood sugar levels rise. And then normally they would come down. The problem with our blood sugar levels being elevated, especially elevated for a long time, is that that can cause damage to the inside of blood vessels, particularly the small blood vessels in the capillaries. Um, when they start to get damaged from the inside, eventually they will start to leak and they can start to become deformed. Things, when I say deformed, I'm talking about something called a microaneurysm. And so there's a weak outpouching of those capillaries or small blood vessels. And then they can also start to bleed. And we think of those as hemorrhages or um, uh, yeah, dot hemorrhages is what we refer to them, or blot hemorrhages if they're a little bit larger, but they're small hemorrhages, they're small bleeds. When I'm looking inside somebody's eye, I'm seeing those small blood vessels. And the blood vessels inside someone's eye are the only blood vessels inside of the body that we can see with non-invasive techniques. I just need a microscope. For someone with diabetes, I'll always try and put dilating eye drops in. So they dilate the pupils. So it's a lot easier to see inside of the eyes. And so it's a lot easier to see those blood vessels. And so when I said earlier that it's like a window into someone's cardiovascular health, it's just that I can see your blood vessels inside of your eyes. And if they're really healthy, they're probably on the healthier side throughout the body. But if they're leaking and they're bleeding, and I see a lot of different hemorrhages and microaneurysms, that's probably happening throughout your body.
Mm.
Now, I'm not going to change your medications for diabetes. I'm not going to look to do anything like that. But what I'm going to do is I'm going to write a letter to the doctor and say, this is what's going on. This is what the level of health is inside of this person's eye. The second part of that then is, well, it's inside of the eye. What does that mean? And when you have diabetic retinopathy, or your blood vessels are starting to leak and bleed, that can cause some vision changes. It can cause vision loss in some more advanced cases. And it's because those blood vessels are unhealthy, they're causing damage to the surrounding areas, there's leakage, those parts of the macula start to become, in some ways, they can become deformed. Um, and it can cause similar sorts of symptoms to macular degeneration in a way, in which case things can be a little bit distorted, things can be a little bit blurry, uh, but it's different to macular degeneration because the mechanism is different. But those sort of symptoms can be similar. Um, with that diabetic retinopathy, depending on the severity of it, we either can or can't do something. So when we have more advanced retinopathy and there's a lot of bleeding, or there's active neovascularization, so active production of new blood vessels, that is when we will send someone to the hospital or send someone to an ophthalmologist, or an ophthalmologist in any case, to try and treat that. And they'll be treating that with injections inside the eyes. Anti-VEGF is what we refer to it as, and um, that is to try and decrease that neovascularization, decrease the production of new blood vessels, decrease that active bleeding. In advanced cases of diabetic retinopathy that does not have that active bleeding, we refer to that as non-proliferative. Proliferation just meaning the production of new blood vessels. So in non-proliferative diabetic retinopathy, most of the time we're just going to monitor. And depending on the severity will depend on how frequently we monitor. So in more advanced cases of non-proliferation or non-proliferative diabetic retinopathy, we might be monitoring every 3 months. In less advanced, maybe it's only every 12 months. What we do know is that the rate of diabetic retinopathy is much, much higher in Indigenous and Torres Strait Islander Australians compared to non-Indigenous Australians. And I think it is something like 6 times more likely in someone of an Indigenous Australian. So the guidelines that we work around when it comes to diabetic retinopathy suggests that we monitor someone who has of an Indigenous background a lot more frequently, just because of that much higher risk. Of course, it's still relatively high in non-Indigenous Australians, but it's much higher in Indigenous Australians.
I've heard that there are actually some other ethnic communities where diabetic retinopathy has a higher incidence, like some Asian communities, for example, seem to have a lot of incidence of diabetes in general.
Yeah, and a lot of it, part of that is to do with genetic underlying factors. Part of that is to do with environmental factors. And environmental factors include things like diet, or alcohol abuse or alcohol use. So sometimes it's cultural as well, depending on someone's upbringing or someone's environment. There are a lot of different factors that do go into that.